Okay. So, I'm going to just real briefly talk about this cruise ship. It looks like they're starting to bring passengers back from the cruise ship to the United States. This cruise ship is very disturbing. There are now, let me get the 355 confirmed cases from that cruise ship. And this starts off from one case that they knew of. There's 355. So they're going to bring these passengers back from the United States, put them into quarantine for 2 weeks, and then let them go. Now, from what we understand, at least from what people who've been paying attention understand, that this incubation period is longer than 2 weeks. We know that. I don't know why the World Health Organization hasn't figured this out. I mean, we see this woman getting off the ship after she's been on there for 2 weeks on the other cruise ship, and then they find out she has coronavirus. They had to double check, right? The cruise line, I think, said, hey, no, make sure you double check and make sure she doesn't have coronavirus. They double checked, and the second test came back positive for coronavirus. And this is a woman who traveled internationally. So, yeah, the cruise ship obviously doesn't want to feel responsible for that, but they are. They should have waited to release those people. And they should have been more thorough with their checking of their passengers. But, again, it's all about the bottom line. The sooner they got those passengers off, the sooner they can not worry about having to have their ship quarantined. So, the Star Princess, which is the other cruise ship docked off of Japan, they have 355 cases, and they're bringing all the Americans back to the U.S. Hopefully, they don't release any of these Americans from quarantine with coronavirus. Again, 2 weeks, I don't feel comfortable about that 2 weeks number. So, just fingers crossed, right, that this doesn't start to break out in the U.S. from that. Death toll 1,700, and these are numbers from Japan, or China, my bad. I have very little faith in their reporting. And this I found interesting. China's president says he took behind-the-scenes action in the early days of the outbreak. Oh, man. So he's basically saying, no, I wasn't being negligent. You just didn't notice what I was doing. Because obviously you don't want coronavirus to figure out what you're doing, right? Oh, give me a break. Yeah, it's not my fault. That's basically what it's akin to. It's not my fault. I totally was on top of it. No. Behind the scenes action, right. He kept sending out messages to the public. Don't worry. There's not an outbreak. We got it under control, which was all lies. And then he comes in and says, oh, no, we were totally on top of it. We were just doing it behind the scenes where you didn't see. Got it. Thanks for that. I'm pretty sure that's going to build so much confidence in his regime. Yeah. All right, so numbers. Yeah. Not pretty. We have, let's see here. 5 new cases in Singapore, 11 in Japan. And we were looking at this graph the other day, right? And I was telling you we had this spike, then we had the drop off, and then yesterday I saw this rise. And I was like, you know what? This is going to spike hard. And that's exactly what happened. We just had 11 new cases today. So again, what's going to happen is it's going to spike hard, and then it's going to drop off near zero again. And then people are going to start to feel comfortable. They're like, oh, okay, it's dropping off again. All right, we're good. We're getting it under control. And then a week and a half, 2 weeks later, we're going to see another spike like this. But it's going to be even bigger than this one. Singapore actually had a drop down to 5 cases. And again, okay. I believe that this virus kind of does waves because of our method of checking. We don't check people who aren't showing symptoms, and I think that's part of the problem. We need to start taking people who are suspected of having coronavirus, putting them in quarantine, and not even letting them out until we've confirmed with an RNA test that they don't have coronavirus. But they only do a check if someone shows symptoms. And maybe that's because we just don't have enough equipment to start testing all the people who might have been exposed. But our quarantine procedures right now are severely insufficient for containing this. And that's why we keep seeing these new outbreaks, these mini little outbreaks happening across the globe right now, right? I mean, we have these numbers here, right? Germany looking pretty good so far. We'll see how that goes, if they can keep this flat for the next 2 weeks. We'll see. Or if we're just going to see a spike like Japan just saw. Yeah, we'll have to keep an eye on them. But Singapore, I feel like, is the one that's having the biggest problem. We're underestimating it. And one of these countries here, I mean, Japan looks like it's blowing up right now. And again, I don't know the situation. I looked at news reports for Japan, and I wasn't able to find any report. I went to YouTube and I said Japanese news, coronavirus. The only thing they were talking about was a cruise ship. So I don't know if these are cases that are associated with the cruise ship. But the WHO report has that in a separate category. So if we pull up the WHO report, where did that go? Where did my WHO report go? All right, we pull up this WHO report. Right, we have international conveyance, right? 355 cases. And then we have Japan here, 11. I know they offloaded people from the cruise ship into hospitals in Japan. And maybe the people who are being quarantined from the cruise ship are being tested and being found to have coronavirus, and maybe that's where these 11 came from, but I'm not sure because this report doesn't specify. And I've been looking on YouTube. I've been looking up for reports of any kind of outbreak in Japan. I haven't seen anything, so maybe this is associated with the cruise ship, but I don't know. If it's not, if this is a separate outbreak from the cruise ship, then this is bad. This could be very bad news for Japan. This cruise ship, though, is just, I mean, it's an indicator, right? It's an indicator of how infectious this disease is, right? How contagious it is. 355. We're almost at 400 cases from that cruise ship. You know, and part of it is because they just packed everybody in that cruise ship and said, you can't get off this cruise ship. And so that virus is just having a field day. Just tight quarters, tons of people. Hey, heck yeah, perfect conditions for a virus to spread. But yeah, it just keeps going up. And they're evacuating, bringing people back to the U.S. I guarantee some of those people they're bringing back are going to have coronavirus. They're only going to quarantine them for 2 weeks. And again, in my opinion, that's insufficient. Just from the raw data and from the news reports we've been seeing, we see that it's insufficient. But people keep holding to that 2 weeks indicator. You know, maybe they're afraid to quarantine people for 3 weeks. You tell someone, yeah, you're going to be stuck in a box for 3 weeks. I'm sorry. That person is probably going to freak out a little bit, and they want to avoid that. I understand that. But what's more important, stopping a pandemic or trying to avoid hurting people's feelings? We gotta understand, you know, what's more important here. So I don't think 2 weeks is sufficient. But fingers crossed, this doesn't come to the U.S. It seems like currently that we got it under control. The United States had these 2 cases. That was way back, right? So the greatest risk to the United States is if someone who has coronavirus and we don't know they have it comes into the U.S. and starts spreading it. That's our greatest risk right now. Because as we see, it's starting to break out into lots of countries. We have that woman who traveled through an international airport in from Cambodia to Malaysia. We don't know who got it from her. We don't know where it's going from there. You know, all of these minor little outbreaks can lead to someone coming to the United States who doesn't know they have it, right? And our only way of screening people is, oh, do you have a fever? No. Okay, you're good. Just because they don't have a fever doesn't mean they don't have coronavirus. You have to do an RNA test. The problem with that is it's very costly and you know, resources in that regard are very limited. I know the CDC is working on developing, I believe, kits that they can deploy to hospitals so they can quickly test for coronavirus, which would be good. That'll help us contain it, right? Because it's the people who aren't showing symptoms who are spreading it, right? So checking for symptoms to check for coronavirus, you're already too late by that point. So the methods are insufficient. Yeah, other than that, like, there's a lot of optimism too in the news. Right, let me see this report from NBC. right? China, of course, is talking about, oh yeah, we're getting it under control. Because China has implemented very austere measures, right? And they're talking about how their austere measures are finally starting to pay off, and they're finally starting to get under control. And I want to be so sure, I wouldn't be too confident about that, because this thing, again, it goes in waves, right? You have a big spike, and then it starts to drop off, right? And then it'll drop off for 2 weeks, and then people will be like, all right, we're finally starting to get ahead of this thing. We're finally starting to get it under control. And then you have another huge spike, right? It's the waves, right? And those waves create complacency, because generally the general population of the world, right, has a short-term memory in the regard as for something to stay in people's conscience, it has to, happen within probably the last day or two. After 3 or 4 days, if you're not constantly, reporting it in the news, people are going to start to forget about it, right? And they're going to become complacent. And once they start to become complacent, they start to drop their guard, then it gets easier for this virus to spread. Right, but the way the news works is like, oh, you have a new spike. Oh, it's all over the news. It starts to taper off a little bit. Okay, the news stops reporting on it. People forget about it. 2 weeks, and it just starts spreading. And then 2 weeks later, you have another huge spike. Right? And then all of a sudden, everybody's thinking about it again. So it's almost like it's designed to lull people into a false sense of security so it can start to spread even more. It's terrible. So again, not a whole lot going on, but again, it takes 2 or 3 weeks. Over the past 3 or 4 days, there are a lot of things that happen that could be really bad. And then we're going to have to wait 2 weeks, 3 weeks to see if those things, to see the impact of those things, to see if that created a pandemic or not. So, yeah, keep your head up, and thanks for watching.